Okay guys, I'm going to show you how to do an LP. So first things first, gather in our supplies in the lovely clean supply. It's going to be on the procedure cart. Second shelf from the top, right in this beautiful bin. It says tray, lumbar, puncture, peds. I'm going to grab one of these. They're kind of long and they have all the stuff on it, labeled with sizes and everything. And what's really nice about LPs is most of the stuff, like all the other kits, is all in here. So you need to grab one of these, and then right above where you grab the tray is all the spinal needles. And I always like to do, and it's just a good rule of thumb, is grab an extra one or two of the size you think you'll need, and then once the provider confirms what size they want, grabbing the extra one, because there is on every kit a 22 gauge 1.5 inch, but sometimes the kit is bigger, sometimes they're smaller. That is the smallest size, sorry, correction. But sometimes they're bigger and they need a longer needle, and so I'll just grab the size. So say for today we're doing a little infant, I would grab like this, a 1.5 inch 22 gauge and a 2.5 inch, and then I'd ask the provider and then grab an extra one of whatever they want. But all your spinal needles are here. Here's an extra tape and marking pen, but grab this, grab that. And then good tips to know: your ultrasound covers, the sterile gel, and then your extra drapes and gowns are all here. LPs are a sterile procedure, and if it's a bigger kid, you're gonna need more drapes. If it's a baby, just use sterile towels so you don't drown them. But these are also in the line and chest cart. So I would grab your LP tray, your needle, and then grab the chest cart. Okay, so now we have our chest cart. Here is the setup of everything you're going to need. So obviously you have your kit, your extra spinal needles. So you're going to need a ChloraPrep, which ChloraPrep is in the second drawer of this one, and then in the line cart, I want to say it's the second from the bottom. So either way, second drawer. And then you're going to need your drapes or your towels. You're going to need the gown for the provider. And then everyone in the room is going to need a mask and a bouffant. And if you're not like getting sterile, you'll need the gown, whether or not they're on precautions or not. It's just a good keep it sterile, like you're changing your line kind of deal. And then obviously you'll need the provider's gloves. You'll need to ask them. One thing with the bouffant too, parents will need a mask and bouffant, but they don't need like a gown per se because they're not gonna be next to the patient. There's extra gowns and all that sterile stuff in your, what is this, fourth drawer, second from the bottom, and all the bouffants, and then the glove sizes. So that's why I like grabbing this cart, because I can just have it right outside the room ready to go. And then if the LP is taking a minute and they need more ChloraPrep or needles, like, you're ready to go and you have extra. Okay, so with the LP, we have our infant here. You're gonna turn them on their side, whatever side the procedure, like the provider wants to be on. They'll usually do their dominant side. You're gonna hold them and you're gonna do a crunch, basically. My baby doll's not as flexible, but I would turn more, so kind of like hold the head, depending on what airway they have. You'll have RT with you too, but you're just gonna kind of hold their butt and the top of their shoulders and just kind of crunch them, and then you sit and hold them the whole procedure. And he or she will then cover the drapes and stuff over, because where they do the LP is usually the lower lumbar spine, just kind of depending on where they go, and they're going to feel for placement, and they'll kind of tell you to like bend them more, bend them less, depending on how it is. But you'll just sit there the whole procedure and hold, or you could be an opener and getting them supplies. But even with bigger kids, same thing. You'll turn them on their side. Toddlers a little hard. You might need 2 people to hold just because they're really wiggly, but they usually go a lot faster for LPs. But have them crunch. If they're a bigger kid, you could just have them get in a fetal position, just tuck like they're gonna cannonball and hold themselves, and then you'll just want to hold them too so they don't flinch.